Welcome to another episode of Med Madness, where we dive deep into the essentials of medical knowledge for USMLE Step 1 preparation. Today we're continuing our series on cardiovascular drugs with Part 2. We'll explore 5 critical sections: cyanide poisoning from nitroprusside, digoxin toxicity, statin-induced myopathy, orthostatic hypotension, and amiodarone side effects. Understanding these topics is crucial for medical students, as cardiovascular drugs are a cornerstone in treating numerous conditions. They come with significant benefits and potential risks, making it essential to grasp their mechanisms, clinical manifestations, and management strategies. In this episode, we'll cover cyanide poisoning from nitroprusside, digoxin toxicity, statin-induced myopathy, orthostatic hypotension, and amiodarone side effects. Let's delve into each section with real-life case studies to illustrate these concepts vividly. First, let's discuss cyanide poisoning from nitroprusside. A 55-year-old male with a history of hypertension is brought to the emergency department after being found unconscious in his garage. He has been on nitroprusside for hypertensive crisis management. On examination, his skin is cherry red and he exhibits tachycardia, tachypnea, and confusion. Cyanide poisoning can occur from various sources such as structure fires, occupational exposure, and medications like nitroprusside. Cyanide inhibits oxidative phosphorylation, forcing cells into anaerobic metabolism, leading to lactic acidosis and cellular hypoxia. Patients may present with hypertension, tachycardia, tachypnea, confusion, seizures, cherry red skin, and metabolic acidosis. Immediate decontamination and supportive care are critical. Specific antidotes include hydroxycobalamin and sodium thiosulfate. Next, let's discuss digoxin toxicity. A 70-year-old woman presents with nausea, vomiting, and severe fatigue. She has a history of atrial fibrillation and has been on digoxin for several years. ECG shows life-threatening arrhythmias. Digoxin toxicity manifests in 3 main ways. Cardiac symptoms include life-threatening arrhythmias. Gastrointestinal symptoms include anorexia, nausea, vomiting, and abdominal pain. Neurologic symptoms include fatigue, confusion, and alterations in color vision. Management involves adjusting the digoxin dose when adding drugs like amiodarone to prevent toxicity. Digoxin-specific antibody fragments or digoxin immune fab can be used in severe cases. Next, let's discuss statin-induced myopathy. A 45-year-old man with a history of high LDL levels is experiencing muscle pain and weakness. He was recently started on high-intensity statin therapy for primary prevention of ASCVD. Statins inhibit HMG-CoA reductase, decreasing cholesterol synthesis but potentially leading to muscle injury. Indications for use include secondary prevention in patients with ASCVD and primary prevention in high-risk patients such as those with diabetes or high LDL. Management of muscle-related side effects includes switching to alternate high-intensity or moderate-intensity statins. Measuring serum TSH levels can help identify statin-induced myopathy. Next, let's discuss orthostatic hypotension. An 80-year-old woman reports dizziness and fainting episodes upon standing. She is on multiple medications, including antipsychotics and vasodilators. Causes of orthostatic hypotension include medications with alpha-1 blocking properties such as antipsychotics and vasodilators. These medications disrupt the baroreceptor response, leading to insufficient vasoconstriction and reduced cerebral perfusion upon standing. Next, let's discuss amiodarone side effects. A 60-year-old male with a history of atrial fibrillation presents with progressive shortness of breath and a dry cough. He has been on amiodarone for the past year. Pulmonary side effects include interstitial pneumonitis and organizing pneumonia. Endocrine side effects include hypo or hyperthyroidism. Hepatic side effects include hepatitis. Cardiac side effects include bradycardia and QT prolongation. Dermatologic side effects include blue-grey skin discoloration. Neurologic side effects include peripheral neuropathy. Ophthalmic side effects include corneal microdeposits and optic neuritis. Understanding the mechanisms, clinical presentations, and management strategies for these cardiovascular drugs is essential for effective patient care and success in your USMLE Step 2 exam. Remember to engage with pre- and post-podcast quizzes and use Anki flashcards to reinforce your learning. Stay curious, stay motivated, and keep learning.